Hello and welcome to the Minds on the Frontline podcast. I'm Jeff Lassers, one of the Minds on the Frontline podcast hosts. I am a professional firefighter, paramedic, educator, and content creator. My co-host today is Mike Matter, a firefighter, paramedic, and peer support team leader. Today's episode is an honest and evidence-based talk about one of the most common coping mechanisms in frontline culture: alcohol. From celebrations to stress relief, drinking has long been part of the rhythm of public safety life. But what is it really doing to our bodies, minds, and overall well-being? Our guest today is Dr. Andrew King, an emergency physician, medical toxicologist, and addiction medicine specialist at Wayne State University and the Detroit Medical Center. Dr. King also serves as the medical director of the Michigan Poison and Drug Information Center. During this episode, Dr. King explains what alcohol does to the brain, along with the short and long-term health effects, and the myths that continue to obscure our understanding of, quote, healthy drinking. We also explore how alcohol use can become a coping mechanism for unresolved trauma or ongoing stress, and why showing compassion rather than judgment is essential to helping someone who might be struggling. Minds on the Frontline is brought to you by the Frontline Strong Together 5 program, offering 24/7 mental health and crisis support for Michigan's first responders and their families. For more details about FST5, including free resources and ways to connect, please check out the episode description and follow us on social media. Good morning, Dr. King. How are you?
Good morning. How are you?
Good. All right, sir. Why don't you kick us off? Tell everybody who you are, what you do, and where you do it.
My name is Andrew King. I'm a medical toxicologist and addiction medicine specialist and emergency physician, and I work here at the Detroit Medical Center with Wayne Health and Wayne State University. And we also work at the Michigan Poison and Drug Information Center.
Yeah, you've been here before talking about substance use disorder in the overview, general 30,000-foot view of it.
Yeah.
But today we're going to dial into alcohol.
Yep.
And in reality, our big focus today is evidence-based, providing information to people on what alcohol is and what it does to the human body, and so that people can really make some informed decisions, right? The first responder culture, like so many other cultures in humanity, we have the traditional use of alcohol as a positive thing. You know, something cool just happened. Let's celebrate. Oh, something bad just happened. Let's go have a drink. Oh, hey, what are you guys doing tonight? Want to go have a drink? And this isn't just first responders. This is so many other people. But in the context for this conversation, I think it's important to point out. So it's about balance, I think, as well, as we move forward in this discussion.
Yeah, absolutely. You know, the popular culture, frontline culture, et cetera, alcohol use is very common, extremely common. And you see it on television, movies. There's alcohol. The availability is pretty incredible out there. And so those kinds of things really affect the way that you perceive it. And then, like you said before, you get to make a decision. But I think it's most important that you go into having any of these decisions with the best available evidence for you, so you can make the decision based on your values and belief system and then move from there. But a lot of times people don't have the right information, so we'd like to be able to talk, especially like we're going to get into some myths later, which I'm excited to talk about alcohol and alcohol use and what's been out there. And to be honest, it's been pretty confusing from the medical standpoint, some of the different messaging that's been out there. And it can be even really hard for medical providers to talk about like what's right and what's wrong for people. And so, you know, this is going to be a nice conversation to, I think, put it all out on the table.
Yeah, you know, we brought you in because you're a resident expert on stuff like this.
Yeah.
But you just mentioned that it's even tough on the medical community to know what is and what is not.
Right.
And then we have all these air quote experts on the Instagram and the this and the that talking about the facts as they are.
Yep.
So, man, it really, really, really is confusing. So you're here to really distill that down for us.
No pun intended?
Yeah.
Oh, we got that one there.
Yeah, it wasn't
Well done.
intended, but I'm going to pretend it was.
Well done.
Good dad joke.
Perfect dad joke. So let's get into it. You know, most people know that alcohol is not good for you, for your brain, your mind, all of that stuff. From your medical and kind of toxicological perspective, what is actually happening when we drink?
The first part is the intoxication part. your drinking, and it affects your neurotransmitters in your brain in sometimes some ways that we don't quite understand the mechanism of how it occurs. But the first part is the intoxication, and with that can come some of the rush and the feel good and the reinforcing behavior. You can have disinhibition, so you start doing things that you wouldn't necessarily do, like, I don't know, dancing or saying something, or maybe sending a text message, or there's a whole lot of different things that get disinhibited when we start drinking, right? And so you start losing that ability to make the good decisions, right? And of course, difficulties with coordination can go hand in hand, slower response times, etc. And we know how that affects the way people can drive and function and walk. And then the decisions, of course, that you make during those times, right? Like, should I say something to that person, or should I get in the car, or should I name whatever the vice is that makes it a little bit more of a reasonable thing to do, potentially, like when you have disinhibition, right?
What is breaking down in this chemical? Where is it hitting in my brain to where all of a sudden I'm willing to do things that under normal conditions of non-intoxication seem, what are you doing?
Yeah. That's the disinhibition part. You have executive functioning that says, I shouldn't do this because I can walk through this and say that that's not a good idea, right? Like, you have a lot of protective thoughts that are in your brain. It's like, I probably shouldn't cross the road during the busy time, right? But maybe you drink some alcohol and you're like, I'm pretty fast. And
right.
I think I can probably do this, right? And just things that wouldn't make a whole bunch of logical sense when you're trying to have self-preservation thoughts. Those start go away. They're starting to erode a little bit. And so that can make it easier to make those decisions. Like, I don't feel as embarrassed. I don't feel as socially inhibited. You know, I don't mind doing some silly stuff or saying some silly things. And of course, you know, like I said, dancing, I think, would be a benign manifestation of it for some people. Mm-hmm. And then getting in the car intoxicated would be like a really serious example for a lot of people. Or, I mean, you can come up with tens of thousands of things that you all have seen, of things that seem like a good idea at the time when people were drinking. And then, you know, as a hangover, there's usually like a lot of what happened last night going back over through your head, like, man, I said that, or I did that, because that's not something that you normally would do, right? So it can change the way that, you know, you normally decide to go about your life.
What are some of the chronic and long-term effects, whether it's been drinking or, you know, the glass of wine a day for years?
This is where it gets difficult to describe, like, are we actually losing life years, or is a little bit of drinking helpful? And this is where some of the evolution in the understanding of how these things have occurred recently, especially. For a long time, we heard in the news that, like, glass of wine a day is good. It's good for your heart, right?
Yep.
And then that came from some of the older literature where they're just looking at cohorts. And of course, people are just taking surveys. And then you look at, well, you know, how long do they live? Like, what kind of cardiac events have happened to them? And like, what did they say they drank? And you can get an idea, assuming that everyone was 100% honest on that survey, right? Which there's no reason that they had to be. And that showed that there's what we call a J effect, where just a little bit of drinking potentially is protective from certain disease processes, right? And that's why they would say that it's healthy, and then your relative risk of having a cardiac event for lower amounts of drinking is good. And it's hard for humans to be like, well, little's good.
Yeah, there's an extrapolation where like a rule of thumb gets created based on that information.
Yeah, right.
And then it becomes canon.
Yeah. And then that's easy. Then you hear the thing that you want to hear.
That's the most trios
thing. They said
ever.
A glass of whiskey will
Look
make
at
me live to
social
100.
media. If I look at it, I can be convinced of anything I already think.
And then, so that might be true. And it's been shown a couple of times that you might have a protective effect from cardiovascular effects from, you know, low dose drinking. Usually it's like 1 or less drinks per day for a man or woman. But then the exchange happens too. So maybe your risk of cancer or something else will go up, right? And then that'll cancel out 100% or actually make it way worse because of that drinking, right? And that's been shown subsequently. Again, I'm not going to tell you that we know 100% what the case is, but a lot of the evidence is starting to point towards any alcohol use is probably going to decrease the amount of time that you live. And whether it's like a couple months or a year or many years, there seems to probably be an association with how much you're drinking. That brings me to the point that I really want to talk about, the myths of drinking, right? Challenging the myths, because everyone has that case report, right? They have that grandma or that grandpa or that uncle or whatever that smoked and drank their entire life and they're 130 years old. And so that's the power of the case report, because you have a direct personal connection with that person. That is the exception to the rule. But you're using that illogically as the evidence. And that's really hard for humans to disconnect or disassociate from themselves. Like, I see that one person and they're fine and they did great. Why can't I do it? I'm related to them. So, like, you know, if my uncle is 150 years old and he drank 3 scotches a day, I could probably do that, and I'll live to be 150 years old too. But again, like I said, medicine is really complex, and that's not what we're looking at when we're looking at these studies. We're looking at big cohorts and big populations. And remember, the people who died from alcohol complication, you're not seeing them. They're not in your mind. They're not in your monkey sphere of you to be able to remember, like, oh, man died at 45 from alcoholic cirrhosis. And yeah, but Uncle Harry is 150. So, and then your math, that could be really hard. And we don't do a really great job of accepting contradictory information that comes to us, especially if we have a belief system that we've already created.
Why do you think these myths keep going, even though there's data that kind of contradicts them?
May I?
Yeah, please.
I think he kind of said it like people want to believe what they want to believe.
Okay.
And am I wrong?
That's my best guess, right? Like this is not my specialty, but we see it over and over again, is that you try to bring this evidence in front of somebody and then they will counter you with that case report, right? Like that one person they knew. And you're like, that's great, but that's not talking about the population. And it's hard for us to think in those abstract terms because we have such a emotional connection with the one person that we've seen, right? Or we really want that to be true. So we're going to use that as the evidence, and I'm going to disregard anything else that comes across my plate because these papers are boring. Right. They're hard to read.
One thing that doesn't get brought up, I think, is the type of alcohol. Not just beer versus wine, but the quality of anything you consume. It's like saying bread is bread. No, there's very nutrient dense bread, and then there's like garbage that's just fluff.
Yeah.
Right.
Yeah.
So I wonder, is the quality, the amount, the timing, there's so many variables involved in this. Oh, my grandpa had 3 scotches a day, and you're drinking whatever, pop off or stuff you made in your basement or something. I wonder if that also plays into the quality of what you're bringing into your body.
That is a good question. I don't think anyone's done that specifically. I would guess, there's a couple of things to bring up there. They can be pretty high calorie content. That is not helpful. When you're talking about bringing a 500 calorie margarita versus, 100 calorie light drink, whatever. Again, alcohol is damaging. And so some of the things that we start seeing with increased rates with alcohol drinkers are upper airway and oral esophageal cancers, stomach cancers, et cetera. And that's part of the thing that we see over and over again with the studies is that, alcohol is a risk factor for certain types of cancer. And a lot of those have to do with what the alcohol is directly contacting. So, liver, pancreas, mouth, tongue, esophagus, et cetera. What it's hitting, it's, causing some damage. It burns. And when it burns, there's certain burn that's good, probably exercise, but there's certain burn that you're like, And
especially like the first responders, when we see the frequent flyers, and even in the emergency department, you watch them go downhill.
Yeah, over time.
It's that slow death that you watch.
They're losing limbs in a lot of cases.
Yeah.
It's hard to watch. It's hard to watch like that slow train coming, right? And the writing's on the wall. Unless they immediately stop, they turn it around somehow, it is going to progress. It has a natural outcome. And we watch that happen, unfortunately, in the hospital. And so, that's why it's really important if you set up peer recovery coaches or some sort of intervention when people with substance use disorders come in, at least you acknowledge that with them a little bit. And you can talk it over, like, do you want to keep doing this? And do an assessment as like, what's keeping you from not drinking? And I think those are really important things, at least to address with folks. The evidence is out about, the effect size there, but you can see, I'm bringing my own case reports in, but they could be really amazing turnarounds. Unless you give someone a chance to change, it's going to be hard for them to change, right? Unless you address that change process with them in a reasonable way with someone who is non-threatening, then it can make it really hard for someone to, see a different future.
And it seems like it's only when they feel they're ready. Like their rock bottom is not what we think is rock bottom. Like we can look and go, you're at rock bottom. But it doesn't seem like they even think about changing until they hit whatever their rock bottom is.
Yeah, it's amazing what it takes for someone to change, right? Maybe a change in perspective. Hopefully someone listens to this podcast and starts rethinking some decisions that they're having. That would be really great. Sometimes it could be something that someone said in group. We work in an opioid treatment program here. You ask someone when you start seeing some positive behaviors, like what actually happened there? They said, you know what? John in group said this, and it just got me thinking, and I just couldn't stop thinking about it. And then that was it, right? And it can take an epiphany moment like that, and you never know when it's going to happen. Sometimes it really just takes, you have to put it in their face, and even so, they may or may not change, which is the hard part to watch.
Working in a busy ER where you work, what are some of the alcohol-related medical issues that you encounter most often when you see patients here?
Yeah, so I like to break these down between the alcohol-induced ones versus the alcohol behavioral induced ones, right? And so we'll see. motor vehicle accidents, all the trauma, slip and falls, cuts, injuries, etc. from there. And then the alcohol-induced ones could be a little subtle sometimes, right? Now this person has dementia, has a hard time thinking, and they're coming in because they're getting confused and doing some silly stuff at home, but that was from like a buildup of alcohol over the years. And so there are some changes that you see with chronic alcohol use. You can see vitamin deficiencies. Those would be another one. Then you can see, cirrhosis. We see the bleeding that happens, low platelets, increased risk of infection, new diagnoses of cancer. That'd be more the alcohol-induced kind. And then finally, as a toxicologist, there are some that I think are really important for medical professionals to recognize because we miss it quite often. And as a medical toxicologist, it's an important cause of what we call anion gap acidosis that gets under-recognized quite frequently, but it's relatively easy to treat. So that's some of the metabolic complications that we'll run into.
So it sounds like the alcohol just literally starts decreasing the body's resiliency. And so the aging process goes way faster. It's just like anecdotally, I have no idea what's going on cellularly, but it's almost like a poison that speeds up the aging process and the disease processes.
You brought up a really interesting point because there's some science out there that looks at what we call telomere length on chromosomes, right? And that tells you about how old you are, and
your genetic age versus your calendar age, right?
Guess what alcohol does?
It's got to shorten them, right?
That's right. Yep. You want long?
Yeah, I've listened to some podcasts where I've tried to keep up with some of these scientists, and what I got out of it is long telomeres good indication of genetic health and longevity.
You got it.
I'm not shocked that these things are just shrinking based on the consumption of a poison.
Because we see it, right? And I don't want to gaslight anybody out there. It's like you can watch it happen, like from certain folks, and then we just have to be really careful about the contrasting statements that we have about those case reports that they look fine, or I have some family member. It just happened to happen to that person. It's not going to happen to me.
Or to what degree, right? Well, just because you're not in the hospital because of your constant drinking doesn't mean it's not breaking you up.
Correct.
You know, you don't have to have an ER trip for it to be something that's indicative of not good for you.
And it can be something maybe not medically measurable, right? Like relationships, et cetera, like job performance, your ability to make some income, like interpersonal negative interactions that have occurred because of drinking, right? Like those are consequences that are just as legitimate, if not more so, than certain medical outcomes. And those can be really important things to make sure that we're measuring. And so they could be a little bit harder, in our jobs to do that. But, a psychiatrist or counselor or in group, we can see that those can be some of the more devastating consequences of alcohol use.
Well, I think we see a lot of it in the peer support realm. We don't see the ER trips, right, for the substance use disorder.
You get the phone calls and the text messages?
We get the phone calls and the text messages, or you see the person taking sick time, or, you know what I mean? You don't have to go to the emergency room to have a substance use disorder. Those are the things I'm glad you brought up.
Functional addict,
yes.
I think is a term that would be used.
That's the popular term, right?
Yes.
Like I'm not in the hospital, but and things are falling apart, but I'm not in the hospital, so I must be functioning.
Yes.
Exactly. I can keep the job. It's like, well, how well are you doing your job?
So let's dive a little deeper there. Let's talk about some of those early warning signs that someone's drinking might be escalating to something that's more dangerous. And again, we're not admonishing people for ever drinking. We're talking about an activity that might be taking away from their life. When it truly starts to become an addiction in the literal sense that they can't get over, what are we looking for?
Behavior changes. It could be real subtle. It could be real hard to pick up because people are pretty good at rationalizing, making excuses, covering up for behaviors, doing things privately, quietly. So sometimes those things, unless they let their guard down or you're really paying attention, those things can go under-recognized or unrecognized for a long time until it's way too late. And so if you're looking at behavioral change over time, and then that could be really difficult if you just see someone every so often. But if you're seeing a consistent change in your performance, or if you're seeing like chronic absenteeism, or, the work product is changing, that makes you think that there might be another influence. And so, trying to see what has changed, right? And then you got to ask, like, what is the cause of that change? That could be it, right? It could be a whole bunch of other things, but, substance use is really common. We know millions and millions of people suffer from it. There's really not a good hard diagnostic way to do it as like a peer or a friend or a coworker to pick up on that, unless either someone comes up to you and tells you something, or if you notice something and then you want to bring that up with somebody.
So if we think we're noticing something in a colleague or a friend, more appropriate term here, a peer, What is your recommendation? What are the best ways you've seen people approach this issue for people that care about those that might be escalating towards addiction?
Yeah. Usually when people are suffering with the substance use disorder, they're not super happy about it, or they're embarrassed by it. They're not going to bring it up. Maybe some certain circumstances they might, but in general, they're not going to. And they're going to be really touchy about it, potentially. And so it's really important to use empathy when you're approaching somebody. You can start the conversation with some compassion and a lack of judgment, because I promise you they're already judging themselves. I've noticed you seemed a bit off lately, and I'm here to, if you want to talk, just offer non-specific, just support. And so that I can get them thinking, like, maybe, I trust this person, that I can open up a little bit about some difficulties that I've been having. And then I can open dialogue without placing blame. Make sure you emphasize them as a person and a colleague. And so it's best to empathize, when we're talking to most people about a touchy subject. You can normalize seeking help. And so that would be like framing the conversation around resources available to everybody. You could say things like, this job is tough. I know a lot of guys feel stressed, or a lot of guys are using the peer support program to try to vent, right? It might be worth checking out if you're feeling stressed. And so you don't have to say anything necessarily about the drinking. You could just talk about like how you acknowledging the job is tough, and that there are resources to help you vent, right? Because that's not necessarily a judgmental thing to say. It's like, you got to get that energy out somehow, so might as well do it in a positive way. And so you normalize the use of resources because everyone's doing it. And so you don't feel so bad, or you feel like you're the only person that's suffering. And then knowing and sharing the confidential resources that are, first responder focused can be really helpful. Knowing that there's a first responder program, there's a Frontline.
Like
there.
Just floating it out there.
Just throwing it out there.
Because sometimes they just want to see the raft and you go away and they'll grab it kind of thing.
Is that okay? Yeah.
Yeah.
Right.
And it's probably, Mike, let me kind of lean on you here. You have had, I can't imagine how many interactions with people that have dealt with this issue. Give us some insight. Is this more of a symptom of something bigger going on they're dealing with a lot of times?
A lot of times they're using the alcohol to cope with something. You just don't start drinking like this out of nowhere, especially if it's at your place of employment. You've seen these changes in the person. We work so closely together. But a lot of times, once you get to the bottom of why did you start drinking, that's where they're more apt to go find some help, because you're not there talking about their drinking. Their drinking is a symptom of something else. Some things that we've also done with people who are kind of apprehensive about going to get help was the great thing about people who have gone through something, came out the other side, their best version of themselves. They are very willing to jump back in the hole with somebody. And they're willing to kind of share their story. So there's been times where people were still apprehensive about going to get help. And I said, well, would you like to talk to somebody who has gone through it? They were at where you're at. And just talking to somebody who's been in that same hole with them, a lot of times that's the game changer, is talking to somebody who's been there, who went through the treatment.
Dare I say culturally competent? I mean...
Yeah, well, they're other first responders. Yeah,
well,
exactly.
No, not just that. As a drinker.
Yes.
There's a relationship of understanding that I could lean on you.
Absolutely.
Like our friend Justin Templeton was here saying he really started to believe in peer support when he saw the peers they brought in to help.
Yeah.
He's like, they brought in them?
Yep.
And they automatically got credit. If you're telling me you're having this addiction issue, or somebody's coming at me with it and they've had one, they've gotten over it, and I know that buys a lot of credit.
Absolutely.
Yeah.
Absolutely. But I think in a lot of the conversations I've had with people with substance use, the actual substance use is the small part of the conversation.
Yeah, it seems to be.
We don't start off like, why are you drinking? You're like, hey, what's going on?
Right.
We've noticed this change. We've noticed this change. I know you. You're not acting like you normally act. A lot of times it's that life issue that maybe nobody knew about, or we knew you were going through something and you were trying to handle it. And obviously we're seeing signs that you're coping with alcohol or whatever substance. But I think if you approach it in that, where you're just not focusing on the alcohol, you focus on the person and you focus on what they're going through, it's a lot less judgmental, because you're like, help me understand how we got here.
Yeah.
It's more of I want to know more about you. I want to learn
the root of the issue to get to how do we help you from even wanting to cope.
Yes, because helping with this, just looking at the substance abuse, you're turning a blind eye to what the catalyst of the alcohol or substance use is. Generally, if you can fix that issue that caused them to drink, the drinking takes care of itself almost.
As well as all the other risky behaviors they may be experiencing.
Exactly.
Now, Doc, I feel like when I was growing up, addiction meant a physical, a medical addiction. Like there's this term where like it's got him. There's the snake bite.
Yep.
Do you think it's more of that, or do you think it's more of this behavioral health issue of coping, or is it both?
Mike put it really, really well. Like that is almost always it's a symptom of something underlying, right? And unless you can address that, it's a memory or a thought or a situation or whatever that people have a hard time dealing with themselves, right? So coping is very common. Let's take a step back. I want to actually break down a couple terms, right? Because we use these terms interchangeably and they're not quite accurate. So the first one is tolerance, right? It takes more to get the same clinical effect, and that can be anything, right? Caffeine, alcohol, SSRIs, there's a whole bunch of different clinical effects that we're looking for. When we're talking about drugs and substances and alcohol, it takes, a higher amount or whatever to attain whatever you're going for. Then there is dependence, and then that is really like a physiologic process where if you stop the agent, then you'll have withdrawal symptoms. And so your body comes up with these countermeasures to be able to function and deal with the chronic assault or the chronic presence of that substance, right? And so when you stop the substance, then all those countermeasures get to shine through because they're not being opposed anymore. And that's the withdrawal that you'll see, right? And then that could be a bit substance dependent. And so knowing some physiology is really important there, but that's all that is. That's dependence, right? But we use the term sometimes chemical dependence, or I'm dependent on something, or I have an addiction to it exchangeably, but it's not. So dependence is just that. Then there's substance use disorder and addiction, and that's when you run into the problems, right? That's when you run into the medical problems, the social problems, et cetera. And so using a use disorder means that there is much more than just the dependence on the drug. It could be part of it, right? It's part of the criteria in the DSM to make the diagnosis of substance use. It could be there, but it doesn't necessarily have to, right? You can be a binge drinker and not necessarily have withdrawal symptoms or have dependence on alcohol to meet all of the criteria for a substance use disorder, right? Because you're getting all of the consequences, et cetera.
And we're all
so
different.
It's still a problem. And we're all different, right? Like medicine is messy.
Yeah. You consuming 50 grams of sugar versus me, we might have a different reaction in our bodies.
Yeah.
It's a whole different thing, man.
Yeah.
And that's why I'm glad you broke that up so well, because it allows us to really think about the fact that this is not a math problem.
No.
1 + 1 + 1 does not equal 3. It could equal 50.
There's way too many factors involved.
That's right. It could be a continuum too, and then being able to go from this to that to the, it could be real subtle. And when do you really flip over to a substance use disorder? That can be really tough and different and hard to measure a lot of times. That's why the immediate judgment from people is not helpful, because you didn't walk a mile in their shoes and you don't quite understand what they're having to deal with, right? And so until you know, actually you probably will never know, but hold back any judgment, right?
Well, not even for the sake of empathy, maybe. This is more of a question, but do you believe it's because it's literally useless? You're not going to get them to take a step forward with that. So your anger or frustrations or how you feel, no matter how Rocky Balboa speech you give, is not going to manifest this thing forward if you're being like that.
Well, if you think about it, right, humans are meant to just be psychologically reactive, right? We're just no, I'm not, right? You yell at someone, they're probably not going to do it. And until they can come up with their own motivation or their own rationale for doing something, then you're probably not going to see a lot of change. And you can be counterproductive that way too, right? Because sometimes people will dig their heels in even harder if you yell at someone or give someone undue hard time.
They're called first responders and children.
Yeah. Well, I think another part of it is, the judgmental part is they've already judged themselves hard enough. That drinking is probably coming from a place of shame, sadness, whatever. By you judging them, you're actually making it worse by doing it that way. So, I mean, it's...
So I won't tell you about it next time.
Yeah, exactly. So I'm not going to say a word.
Right.
They're going to hide it even deeper, But what's kind of one thing that you hope first responders learned from the conversation today?
It's complicated, right? It is going to be a decision, but it could be a slippery slope. There are a subset of people that just like it, and they may not be coping with something. It could just be one of those things where it's their brain says, that's really good. I don't tell my kids not to do drugs because they're bad for you. I tell them because you might like it a lot.
It's a very honest answer.
Very honest answer.
So that's one. The second one is, question the stories you tell yourself, right? If you're rationalizing some sort of behavior, see if you can do a little bit of a deep dive into the rationale as to why you're telling yourself that story, right? And then see if it makes sense to you. And then, of course, we're not taking choice away. You just have to be confronted with the fact that it probably is not good for you. And you can make that decision based on your values and beliefs and moral system. Medically, though, because our job is to look out for people medically, is I don't think at this point that there is a ton of evidence saying any alcohol is going to be beneficial for you, right? If we're talking about just like straight life terms, and then all the other things like enjoyment and socialization, et cetera, notwithstanding, I think over time, chronic drinking is probably going to increase your risk or decrease your lifespan. And I say that with an asterisk because we know evidence changes over time, but we're starting to see more and more evidence that's pointing that way and erasing a bit of that benefit that may or may not exist there because of the confounders that we talked before. There's not going to be a great randomized control trial where they give tens of millions of people like they make them drink and then a whole bunch of people that they don't make drink and see, you know, what happens and what shakes out. This is all going to be a little bit shaky, but that's where we are right now.
Yeah, that's about as good an answer you can possibly get on
Buzzkill.
something. Well, no, I mean, it is a buzzkill in the sense of if you really like to drink. I don't think this is new to anybody.
Yeah, I don't think it's going to shock any. You know,
yeah, nobody's going to be like, well, I get my vitamin. No, you don't. No. You know what I mean?
We didn't even talk about sleep.
Oh, we'll get into that.
Yeah.
Yeah, we'll get into sleep on another one, which I'm guessing it does not, and I know for a fact, it wrecks sleep, even on low doses of alcohol.
Yeah, that's what I mean.
Yes.
So, you know, the things that you tell yourself, right? Like, I need this to be able to go to sleep, but then you realize that that's damaging your sleep cycle, and then you're just on caffeine, and you have this cycle that just kind of gets out of control. It's really tough on the body. So, to bookend it, right? Do I need this?
Yeah.
Like, I think that's a legitimate question to ask yourself. Do I need this to go to sleep? And the answer is probably no.
Yep.
Do I really need this? Is this important for me? Like, is what I'm telling myself a true statement? And hopefully this conversation helped a little bit with you to question those assertions that you're going to put out there.
So for anybody who's listening to this, first responder or not, somebody who's listening to this and they go, all right, I want to learn more and I want to get some help. Where should they begin?
I'm going to let you, I don't want to steal your thunder, actually. You tell me.
Well, we'll say if you're in Michigan, if you're a first responder or a family member of a first responder, you can contact FST5.
FST5.org, or you can call 1-833-34-STRONG.
Yeah, for the rest of us, there's a lot of great websites. The state of Michigan has a big list of them. Depends on the county that you're in. There's different intake hotline numbers that you could do. You can go through your insurance provider. You can check out the big federal government websites like SAMHSA, et cetera. And those all give you access to recovery programs and all the offerings that exist out there.
Thanks for coming today.
Thank you so much for having me. I had a lot of fun.
We had fun too. Thanks for coming, and I'm sure we'll see you again on here.
Take care.
Have a good day.
Thank you for listening to the Minds on the Frontline podcast. We have more great content coming out soon. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn. And make sure to like and subscribe to all Minds on the Frontline podcast social media channels. Thank you, and have a great day.